So I hope my screen is visible. So friends, welcome officially once again to Miraculous Mondays or Management Mondays. So this is episode week number 13, Monday 28th March. So we are as usual on time, starting with the episode. So as usual, all my presentations will always begin with thanking the Lord Almighty has given me much more than what I deserve. And this is my brief CV. You all are almost aware of it by now. Gives me a little bit of authority to say a few things and share a few things with you in this domain with you guys. So today's topic is going to be an interesting one in terms of it is another aspect of communication that we usually ignore. That we usually ignore on our website, that we ignore usually in our normal common talk with our patients, and the normal vocabulary we use. So the do's and don'ts of dental terminology, things to avoid in dental clinic or on your website. Say a no to the technical jargon. You'll say, sir, this session is about simplifying the dental terminology, and the word technical jargon is being used. Technical jargon is basically referring to the technical language only. You have to say a no. You may be qualified, you may be educated. It should not be such a situation that every time whenever the patient talks to you or another patient reads about you anything on the website or about you, he should have to look out for a dictionary. He should be having Oxford dictionary in hand to go about that task. So surely this is one aspect I always lay a lot of stress upon whenever I'm doing a consent workshop as well. It is absolutely very, very important to incorporate the common terminology. You may mention the exact words in the bracket, but in a normal terminology used in the consent form, it has to be the very basic words, the translations. For example, edema can be swelling. You can say chronic can be persistent, like that. So there are various words, a lot of terminologies that we especially use in the, you can say, consent forms and in our normal diction, normal talking with the patient, that we try to jump the queue. We try to don't even stop to explain, and the patients sometimes feel embarrassed. We have to remember, however educated the patient may, although there is already a comparatively lesser literacy levels barring a few states in India, there are lesser literacy levels in India. And even if the literacy level is up to date, the patient is well educated, sometimes our diction, our terminologies, our words may not still be clear to the patient. They may be alien for the patient, and sometimes Google will give them a lot of answers. I'll tell you a few examples today. So the do's and don'ts for today. Let's delve into this sphere of you can say aspect of communication in dentistry that hardly people even bother about. So my endeavor to keep you aware of all the possible topics that I can, in a way that you don't short charge your patient in that scene. So as I said, if your target audience is visiting your website and has to take out a dictionary every time, that means your nomenclature or your wordings, the word nomenclature itself is technical. We know the meaning of nomenclature, but the patient might not know it. Just to explain you that a few things have to be very, very easy so that the patients understand it. Because the thing is, even when we are talking normally, the patient may have no clue sometimes what we are talking about. And it can be actually damaging for our patient-doctor business relationship. डॉक्टर ने मुझे बताया बहुत, समझाया बहुत, मेरे कुछ नहीं पल्ले पड़ा, सब बाउंसर चला गया. I knew the doctor. I had gone with the faith factor in mind, so I surrendered to the patient. And when the problem comes in the end of the treatment, the expectations of the patients are not met. The doctor has a defense in his hand. I told you before, मैंने आपको पहले बताया था, डॉक्टर मेरे को तो समझ नहीं आया था, आपको मेरे से पूछना चाहिए था, आपको नहीं समझ आया था, तो डॉक्टर मैंने तो आप पे छोड़ दिया था, आपके पास रेफरेंस से आई थी मैं, you will do a good job, but this is not what I expected. You have given me a disastrous smile. You have given me a this. You have given me a large, you can say, a long lip line, maybe a longer contour of, or you can say a shorter contour of the ground. Probably these are the few things sometimes we do not understand We do not try to even make the patient understand. And there can be sometimes too much flashy, too much technical language, which is clueless for the patients, and they become sometimes our doom as well. The patients have to be explained these things. As I said, what you do in your talking, in your communication, then the same thing goes on your website. Then parallelly, the same habit goes on your consent forms. Understand, how you do one thing is how you do everything, is the logic behind this today's session. So if you are too technical you may be brilliant, you may be a topper, you may be intelligent. But if you are at a graduate level and the patient is at a KG prep level, you have to come down to patient's level to understand. Say, for example, if you have small kids in your home and asks you a technical question, he's in first standard, second standard, and he asks you a technical question, AC hawa thandi kaise karta hai? Will you give him the condenser and the thermostats and all those things? No, you won't. You will explain the same coming down to the kids level. Similarly, you have to understand that the patient has not done the BDS or MBBS. We have done it. So we need to come down to patient's level to make him understand. Sometimes these things can become doom. For example, a complete family care and cure clinic. Nothing wrong in it. I'm not saying that this is the wrong terminology, but it does not actually spell out what you do. Then we offer technical solutions for the progressive innovations. Pretty much on the higher side. फिर आपसे आगे पेशेंट पूछता है, normal educated patient, I'm not talking about the illiterate patients. Doctor, do you do root canals? And then we feel offended. अरे यार डेंटिस्ट है, सब काम करते हैं. And when the patients, you refer sometimes to the patient and the patient say, doctor, आप सारे काम नहीं करते हो, you are referring for this task to someone. Again we feel offended. You have to draw a line where you are offended, where you are not offended. So of course, patient language, patient communication has to be very, very simple in that regard. So the patient should not be, you can say, having nightmares about understanding your communication, having understanding your terminology, your diction levels. So there are a lot of terminologies used in you can say in dentistry: sinus lift, root resection, hemisection, SAP system, self-adjusting file system. I mean, these all can be a challenge for the patient to understand that all these things at a first glance. Remember, we also never understood these things in the first time. And similarly, if these things are placed on your website and you are targeting a few patients, then you should make it a point to address confusing terms. The easiest way is, if you can't simplify certain terms, you can offer a convenient glossary on your website, marking a hyperlink over there so that the patient can click it and go to the glossary on your website only and not go to Google. And along with the page of FAQs. The problem is that we don't place the glossary in the FAQs. Or if you're using technical language, you have to use a glossary. Glossary means the dictionary kind of a thing, or the frequently asked questions. Keep updating them. So let's come to the do's and the don'ts precisely in 5 points that I'm going to give you before I jump onto the Carry Home Gyan for today. So let me give you a few do's and don'ts when it comes to dental terminology. The first thing, we have to believe strongly that we should not assume, we should not let our patients assume or presume that जो नई सर्विस आई है वो उनको पता होगी. वो आपकी लाइन है, वो जरूरी नहीं है पता हो सबको. आप अलाइनर्स करते हैं, आप क्लियर ब्रेसेस करते हैं, आप वाइटनिंग करते हैं. द पेशेंट में स्टिल आस्क द सेम एज आप ब्लीचिंग करते हो, आप दांत सीधे करते हो. आजकल कुछ और सिस्टम आया हुआ, पता नहीं, सुना था. सो डोंट एज्यूम और प्रिज्यूम by saying it, आपको इतना नहीं पता है तो लेटेस्ट चीज है. The patient might be an engineer, he might be well versed with his you can say his stream updates. He should not be in sync with our stream updates. This is a service he uses when he has a problem. Keeping yourself updated on one thing is one aspect, but going overboard in that thing is another aspect. So don't expect your patients to go overboard about knowing about the products and services. Then the second is do have an easily accessible glossary available on your website, no matter how basic terminology may seem. आपके लिए शायद रूटीन वर्ड होगा, पेशेंट के लिए नहीं. आज भी majority of tier 2, tier 3, tier 4 centers, I'm not talking tier 1, tier 2, 3, 4 centers में people आज भी RTC बोलते हैं. They never say RCT, majority of them. And sometimes if you tell them what is RTC, do you know what is RTC? They will not be able to even spell out the full, you can say, a form of the same. How can you, that is the most basic thing. An extraction, restoration of filling, I mean, or a root canal are the most commonly done treatments in most of the clinics in India. Even in world, I would say. These are the most common clinics. But still, if the patient says RTC, you can expect that the patient does not know the full form. So try to understand, even if the terminology is basic for you, you should be able to, the patient should be able to explain or understand those things. And then when you, the third rule is when you try to explain them and they get, you can say they don't understand it, do not get frustrated. This also amplifies the importance of a scheduled consultation. When you have scheduled a certain particular time about for the same, you will not feel panicked, you will not feel frustrated, you will have all the time in the world because you don't have any patient sitting in the waiting for his turn at an appointed time and you're getting late for him. No, because you already dedicated that time to the appointed patient. So remember, when we learned these things for the first time, a few things, even in UG, even in PG, even after those, we also needed detailing sessions, demo sessions, and sometimes hands-on. And then we got a hold of certain things. So it is our job to educate the patients. I always insist on the alternate IND, inform and educate. That is where the conversions are going to come. That is where the patients are going to be pulled towards you. Don't push it like a car salesman. Always assume that the patients will be pulled towards you. That is a better approach, better magnetic approach, I would say, rather than pushing the patients. So don't get frustrated if they're not understanding. I told you, if you are a graduate or a postgraduate, make sure that they are in first standard or second standard. You have to come down to their level to make them understand. That is where the lot of importance goes in the audiovisual aids, maps, pictures, images, diagrams, videos, whatever you are using to explain your patients. Once the patient connects with you, the conversion will automatically get very, very easy. The connection problem is missing. The patient enters into your clinic and you believe that the patient has come to you, he knows everything. We just basically start the treatment. That is where the consent thing and the other communication part, the consultation part goes out of the window. If you have no patient sitting in the waiting, then only you can do it. Yes, I understand most of the people work on appointment basis today, in today's times. But still people give appointments as per multiple chairs, not as per their own, you can say, acumen or the helping hands they have. So make sure that you don't repeat those mistakes. Then number 4, sorry, this was number 3, sorry again. Do make a note of common issues and misconceptions. This will make it easier to answer future questions and to compile new content for your website. Always have a query page, always have a ask us page, contact us page, where the patients will always find it to, you can say, understand. And if the questions are pertaining to a particular problem, make sure you simplify that section on your website. And the same thing in your clinic as well. If a consultation about a certain topic, about a certain, you can say, specialty is always needing more of detailing, make sure you have ample amount of understanding stuff ready for the patient to understand. Never be in a hurry to start the treatment. That is the bottom line. Once you have that connection part, once the patient is a patient and you are on the same page, it becomes a lot more, the navigation becomes a lot more easier. And that is where the problem comes. We are always in a hurry to start the treatment. Never be doing that. Then don't make your potential patient track down your information. That is, don't bury your FAQ page under a pile of text links. ताकि वो end में जाके FAQ खुले. Make it easily accessible. Make it searchable on your website. Then the last, do arrange your website in a logical order and check that your most popular pages are prominently featured. Now, this is one aspect of 506 rules to be done on website. And now these rules are to be demand and easy terminology. It is very, very, very easy for the patient to deny. I was made to sign on the form, which I did not even understand. That is where the importance of simplifying the form and the importance of witness on a consent form comes. I hope you are trying to, if you have been watching these lives together, I have spoken on these topics in varied forms in the previous 12 lives. And probably by the end of 26 lives, you will have all the dots joining together, all of those who have been attending these lives regularly. So say no to technical jargon, and there should be no blah, 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 blah. Come down to the patient's level and make them understand. Yes, there will be still many people who will say, nahi, main to karke seekhunga, main apne haath se karunga. Explain them. Life is too short to make all mistakes yourself and then learn. You have to learn a lot of things by tell, show, and do. It does not matter if your whole life you have been doing it. We all are adaptable. I am an avid reader. I used to read a lot in the paper format till 2010. Of course, I had my first PC in 2002, but I did not develop the habit of reading online or reading habit of reading PDFs. By 2010, I had developed a little bit of taste, and now I find it difficult to read on a paper book. I used to read a paper book or any novel or any while I was traveling for my offline workshops all over India. So ever since the COVID hit exactly 2 years back, the traveling has been very much limited because even I am doing my online stuff in a much better way rather than traveling every alternate weekend away from the family. I'm also enjoying the online thing from the top of my. So what I was trying to tell is that sometimes we try to ignore the whole aspect, and when I can do, I developed a reading. I was telling about the reading part. So now I am not traveling, so I find it hard to read my at least 8 or 10 novels are unread still now, which I ordered during maybe the 2020 Diwali sale or the 2021 Diwali sale. I usually buy a lot of books during those Amazon sales. You get it at a good price, or usually the good launches are also there around that time. So sale makes it even easier. So not that I don't buy in through the whole year, I do that, but at that point of time there are a lot of new launches happening. So I'm reading all my stuff online now. I'm exploring many things online. I finish a PDF file of 3 pages, 2 pages in 5 minutes, 7 minutes flat. But if people give an excuse that no, मैं तो किताब से पढ़ सकता हूँ, मैं वो कर सकता हूँ, sorry, human body is so adaptable, then you have not even explored 1% of it. So if you are not adaptable, you will fall behind in the race. Remember that. So let's come to the carry home Gyan, telling you about the do's and the don'ts and everything in a summarized version. So we all use unintentionally sometimes words which are unfamiliar to the patients. We fail to realize that patients might not be understanding those meanings. Some concept may be familiar, some would be not clear, but mostly would be alien to the patients. So the first thing is you should speak slowly, avoid technical stuff, and repeat points to help improve patients' understanding. Remember my one line, how you do one thing is how you do everything. I read it somewhere long time back, but I applied it a lot in my life. I use this third point terminology in my workshops as well. I emphasize on a lot of repetitions because I know the audience which is there to learn these things, when they have a continuously imbibing of the facts, they'll come out a better learner in this situation. So the first thing, again, as I always say, the needs and you can say the needs and the wishes, needs and the wants need to be ascertained. What the patient knows, you need to understand before we launch into a level, so that patient को बताएं, डॉक्टर अगर यहाँ से दान निकाला तो क्या होएगा, इम्प्लांट होएगा, साइनस लिफ्ट होएगा, बोन ऑगमेंटेशन होएगी, can say ridge sectioning होएगी, whatever you have to. Don't get into that too complex thing which might be not understandable to the patient. Don't go delve into those discussions. If you are discussing about whether the tooth can be saved or not, the tooth can be saved via root canal. The other aspect is if the patient doesn't want to save it and wants to undergo extraction, your discussion should be limited to that. You should not be reaching bone augmentation and sinus lift in that discussion. So keep yourself into those things. One of the recent surveys that I had read, it said that doctors often use words that were unfamiliar to patients, so that patients did not understand. Like by the word chronic, we frequently mean it is a persistent thing. Whereas a common alternative or understanding of the word by the Google, which is understandable, is to mean severe. Chronic gastritis is recurring gastritis, persistent gastritis. Severe gastritis nahi hota hai. Just to give you an example. Chronic pain, it is not a severe pain, it is a persistent pain, persisting since many, you can say, weeks or days. So too often we actually fail to recognize the needs of the patient, about what they understand about health, and that is where the patients fail to receive the right care at the right time. The logic is simple, as I say, alternate I and E, inform and educate. The more you do of that, the more people will be converted to you via treatment. So low health literacy levels, otherwise, as I said, even in an otherwise educated population, there are a lot many things which are there. So don't create a complex information which becomes difficult for the patient to comprehend or understand. So do communicate in a clear and a manageable way. And that is the bottom line carry home again from me, from my side for today. So do think about it. I hope I have put you into that mode. I do try that at the end of each session. So the carry home gyan, some of you might be saying gyan mat dena. I'll still keep on trying. Never mind. Thank you so much for being a patient listener, patient audience. So this is my WhatsApp groups where you can connect with me. I plan to limit these groups till 6 only, and the 6th group is about to be filled. If you want to join these education-based groups, which are advertisement-free, do send me a message on my number. I'll add you in my groups. So this is my YouTube channel. As on yesterday, Sunday, 27th March, 440 plus videos are already there. So do join my channel and get benefited from the videos. So do send me your feedback on my cell, because or on the FB page where you're watching. Bookers and Big Bad both would be welcome in equal measure. Thank you so much. And I stop my share for questions or acknowledging the visitors on my page where this session is happening live. So hello, Dr. Ramchandar. Hi, Rajat. Hello, Dr. Parul. Hi, Gauravji. Hello, Manindrajit. Hi, Manuji. Hi, Bhola. Thank you, Dr. Ramchandar. Thank you, Dr. Pooja. If any questions are there, please let me know. I'll be more than happy to answer. I'm here for 2 minutes, or else we'll break for today. So friends, make your communication strong, make your communication easy, make your communication long lasting for the patient to understand, comprehend. The patient sometimes needs a second opinion from the family, not from the dentist doctor or the you can say any other physician or doctor. I'm talking both for the dentist and doctor then. So, but they might be needing the same from their family members regarding that. So make sure that your communication is easier, exciting, interesting, so that the patients are attracted towards you. That ये doctor को समझाना आता है तो इसको काम करना भी आता है. It is a halo effect kind of a theory that you create a halo effect if you can say are presentable, you talk nicely. The halo effect is created कपड़े अच्छे पहनता है, बात अच्छी करता है, तो ये काम भी अच्छा करता होगा. This is the halo effect theory. So make sure that you fall into that. So I hope today's session has been fruitful. Okay, Dr. Pooja says, "Sir, sometimes patients understand treatment plan but fail to turn up or keep delaying." Dr. Pooja, that is a different scenario altogether. That is your understanding that the patients do understand that. Probably they might not have understood the same in the first place. And it is not always related to what the patients are deciding about that. There is a lot of other factors into that goes into the same. How you conveyed your treatment plan. We are discussing the communication part of creating the awareness of the treatment first. So if you're conveying the treatment plan, how confident you were, how you can say how much presentation you had in adding to that. If the patient had a question, any cases done till now, any before afters, or maybe they wanted to do it, how successful is the treatment that you have recommended to them. So they might be delaying because of those factors. Plus, internal marketing factors play a lot of role in that. It is not always that the communication or the sweet talk will do the trick. वो soft skills जो होती हैं, they work only till a limited in a limited manner only. मीठी मीठी बातें ज्यादा देर काम नहीं करती हैं क्लिनिक में. Yes, it does not mean that you have to talk harshly. That still means you have to talk nicely, but the confidence oozing thing should be there. You should be super confident of your treatment plan. I always suggest that whenever you're planning for certain treatments, always buy some time from the patient. Make a treatment plan, write it down, sleep over it. Next day, go over it over the same again. Let your subconscious mind work in the night. And if the subconscious mind had suggested any corrections in the morning, go through your plan once again and then call the patient to convey the treatment plan. The proper sequence, the proper timing, the proper, you can say, costing, everything should be crystal clear. That is where I always encourage the participants on my workshop also to do role rehearsal and role reversal things. When you become patient or you become a doctor, to actually iron out all the questions what the patients may have in their mind to become your prospective patient. I'm talking about the new patients, of course, here, as you said. So if the patients are not converting, there is a lot of other factors that I've just mentioned. It is not always about the sweet talk thing. So your question is how to remind and convince them kitna stock kare. I mentioned it, Dr. Pooja. You don't have to push. Don't be a car salesman. You have treated you have given the treatment plan. Don't call and say, "Hanji, aapka kya vichar bana?" That should not be done. That is a wrong approach to have. So obviously, giving a courtesy call, wanting to fix the appointment, always be very polite. Always let the staff do the talk, or maybe if you want, you can yourself also do the talk. Ask politely, should we fix up the appointment for you? That should be the straight talk. We discussed it, should we fix up the appointment for you? The parent said, no, abhi mujhe aur time chahiye sochne ke liye. No problem, sir. Please keep us informed in case you have any questions regarding our suggested treatment plan. That should be the approach. It should not be like कि यार उसको उसको हमने प्राइस कम दिया था, उसको ये कम दिया था या ज्यादा दिया था, blah blah blah. Those reasons should not be coming to your mind. Remember, many times you have only one chance to impress the patient, and that should be your best chance. And time factor always comes a lot handy in that. When you have two patients sitting in the waiting and you're doing a big consultation, absolutely a wrong approach. You're doing injustice to the consulting patient, also doing injustice to the patient sitting in the waiting also. So always buy some time from the patient, take a proper time when you are ready, oozing with confidence, not in a hurry, then convey the treatment plan. Maybe that might have been the difference in whatever you have been conveying before or whatever you will be conveying in the future after my advice today. So I hope I was able to answer your questions in the way you wanted. If I have understood those correctly, do let me know in the chat box. So any more questions? I'm here, or else we break for the day. Okay, guys. Thank you so much for being a patient audience. I'll see you with the next episode on 31st of March The year ends with the finance session. Perfect way to end the financial year with the Thunderous Thursday session on 31st of March. Bye-bye, friends. Take care. Do put in your feedback. Thank you so much. Take care.